Hey, there we are, and happy Monday. Oh, I got to put that up. I always forget to do something, right? There we are. Happy Monday. Welcome. It's official now. And thanks for joining me. As always, I'm your host, David Burrows. It's starting to get closer, right? It's just getting, you know what I'm talking about? Snow. Please don't throw apples at me. But it is coming, right? Wow, what a crazy windy day yesterday. If you're watching this live today, Monday. And sad to say, I have to put the motorcycles away this week. It's a hard time of year for me. But we had a great summer for it, actually. So thank you, Mother Nature, for what you do give us. But every once in a while, she's got to throw us a curveball, right? So appreciate and enjoy the weather while we got it. Because I even heard somebody say the other day, they were actually, I'm ready for snow. I was, a meeting this morning. And I'm like, how do you say you're ready for snow? I guess it's just going to come whenever it's ready, right? But that also means, right? I can say it now. Christmas is almost here, right? I see some of my guests in the background kind of frowning, actually, already. Like, oh, don't say that yet. But it's going to be, yay, right? It's going to be here, and it's going to be different, right? Of course. Obviously, pardon me, gatherings are going to change and Christmas parties and all that stuff. Something that's very important and a tradition here in Sarnia for 46 years, Christmas on the farm. Yeah, that's going to look a whole lot different this year, but it's changed up. Yesterday, I was at Toys R Us with a representative from Toys R Us and Rachel View from the city, and a representative from Kiwanis, and we did a live broadcast from Toys R Us, and it's called Christmas Off the Farm, right? So we have to learn how to adapt to these things. Santa Claus even made a bit of an appearance on our broadcast, and he is reaching out to everybody saying, send me your letters. So what you do is you go to the City of Sarnia website, sarnia.ca, and look for Christmas Off the Farm, and they have a template of a letter you can download. And the kids can fill in the blanks, or you can just write your own letter as well. And then you can head down to Toys R Us and drop your letter off to Santa up till December the 4th. And Santa will reply to you. They're going to be doing some video shout outs, or they're looking for you to send them some video shout outs. How do you celebrate Christmas? How do you say Merry Christmas? There's lots of different ways that people celebrate that. And they want about a 6 to 9 second video clip. You can just do it right on your phone and just say, I wish you a Merry Christmas, or however you want to say it. All the information, again, on where to submit your videos is available at sarnia.ca. I've been saying for a long time, it's great to see this kind of stuff, but it's really forced us to become a little more creative, right? We kind of go, how am I going to do that thing that we've always done? And now we've kind of had to get out of our lazy boy chairs. I guess sometimes we get comfortable and we have to go, okay, how are we going to work this out? And seen some really creative things happening out there. So kudos to the city of Sarnia, the Kiwanis, and of course, Toys R Us joining in this year for Christmas Off the Farm. I'll be doing some more broadcasts with the city of Sarnia coming up as well. Those shout outs are going to be happening on November the 30th. So we did that for Canada Day as well. We did some Canada Day shout outs. And again, the creativity that people come up with, and they get decorating things or whatever. So I'm really looking forward to seeing all those and having to edit them together. All right. We always go out to our comments to see who's watching or brave enough to say hello. Hello, Dom Fernandez. We'll be talking about him in just a moment. Thanks for the great wishes. And Carl, good afternoon, Carl, watching all the way from Oshawa, Ontario. Danny Cachamilio, nice haircut. What? Thank you very much. It was just done today. That's because you saw me on the weekend and I looked a little bit different. And my good friend Ryan Werschler out there as well. Hello, sir. The lawnmower races. Oh, you were talking about that. Yeah, that was a lot of fun this summer, right, Carl? So we'll be back broadcasting that again as well. Wherever you're watching from, don't be afraid to say hello in the comments. We're broadcast throughout the world, actually. We're live in Australia right now, our friends in the United Kingdom, and throughout the United States, watching us from all over. So we appreciate that as well. And we appreciate the comments. And while we're going to be talking to our guests coming up in a few moments, feel free to ask your questions. Challenge the guests when they're here, right? Okay. Let's show you a few things. My friend Dom was happy to say hello because he knows I'm going to be talking about him. Congratulations to Dom Fernandez on finally completing his book that he's worked on for over a year. It's been a dream longer than that. A lot of obstacles along the way, but finally it has become a reality, as Dom talks about his new book, My Journey with MS, now available on Amazon. So just go in Amazon.ca and type in My Journey with MS. And I was very proud, too, that Dom asked me to write the foreword for his book. So Dom's a very inspiring fellow. I've known him for over 25 years now, so I'm very proud to see him bring this to light. So once again, now available on Amazon, My Journey with MS by Domingos Fernandez. Way to go, Dom. And there's still some time to, I don't know why I'm a little choked up here today. Pardon me. No, I'm okay, really. I've been tested. Shepherd's pie or lasagna is a delicious deep dish, and you can get that for supporting the United Way Sarnia Lambton. And you just give them a call. We'll put all the links after on the Facebook page that you can get all this information. You know what? I'm going to do it. I usually do this before I go live. You never know what's going to happen when you go live, right? There you go. That's why I always keep one hand. Okay. It's okay. We're live. You can do whatever you want. So great way to support the United Way of Sarnia Lambton. And there's, again, phone numbers and email on the screen there. I know it's probably hard to see, but we will post that after the show as well, as we will for all of our guests, how you can get information. This is an important one for sure. We've all experienced this probably at some point in our life, whether we were young or even at older ages. Bullying is still a problem. So we want to talk about and make aware that Bullying Awareness and Prevention Week happening right now all the way up through to November the 21st. And I've got a couple links here that I want to show for you. Multitasking. What can I say? I'm not good at it. bullyingcanada.ca. There you go. Check that out online, and how you can get involved in your local community this week as well to help create the awareness and prevention of bullying. It's so different now, right? You know, like when I was in school, which was a while ago, we didn't have phones and stuff, and that's probably added to all of it. I'm not saying all social media and phones are bad. Don't get me wrong, but it's a new form of bullying. And my children experienced it, and probably yours, and it's becoming more common. So we still have to have these conversations and do what we can in our communities to stop the bullying. So all this week, you'll be seeing some different posts on my Facebook page. We'll show you some different links and resources and different ways and things you can do, how to talk to your children. And if you don't know how to talk to them, where can you get support on how to prevent bullying? So again, Bullying Awareness and Prevention Week, running all the way through until the 21st of November. And then, perfect timing, of course, it's November 20th is National Child Day. What's that all about? Well, it's about the rights of children and how children should be seen and heard. And another great place to learn more about that, childrenfirst.org. I guess there was a time, I guess, when we would say things differently, like children should be seen and not heard. We would probably say that several years ago, but certainly that's not true. We know that. And children do have rights, and it's important that we take the time to listen. You know, I think sometimes we just we do a lot of talking. I'm supposed to talk a lot. I'm a talk show host, but you still got to learn to stop, slow down, and listen, and really hear what our children are saying. It's important to listen, but it's important to hear what they're saying, you know. And it's not easy being a parent, right? There's lots of books written out there about it, but it doesn't make it any easier. And we need those resources, and we need to be able to, I think one of the toughest things, and I've talked about this, I do another show, the mental health show. And one of the things that we talk about a lot is it's really hard to ask for help. You know, maybe we go, well, I don't want to ask for help. I'm too proud, or I don't want to look silly or whatever. I think it's important that we be able to ask for help. And there's lots of resources out there, and our children need to be able to ask for help as well, right? So that's why it's important to celebrate this day. I will have a special interview on Friday that will be released to talk about National Child Day with some local representatives. So we hope to take the time to seek that out and have a look at that as well. So again, some important dates. Once again, bullyingcanada.ca, and of course for National Child Day, childrenfirst.org. Alrighty. Well, did I talk enough yet? Oh, my guests are all ready. We're going to bring them on, and because I know they're ready, and I'm really excited about my next few guests that are coming here because they've got some great. We talk about resources and things that we want to share in the community, and this is going to be one of them right here. Hello, welcome.
Hello.
Thank you.
How are you doing, David?
I'm doing fantastic.
Good.
You got all your technology all figured out and everything, right?
Yes, I think we're good to go. I feel like a fighter jet pilot, but it's all good.
There you go. You just need some wings on your shoulder and away to go, right?
Absolutely. Before we get started, David, I didn't get a chance to say it in the green room there, but thank you so much for hosting the poverty rally last month. COVID has canceled so many events in our community, and that was a really important one to keep going. So I wanted to do that right off the hop. So thank you for that.
Oh, my pleasure. I was glad to be able to bring that tool. So it was an important day, right? For a lot of different reasons. And poverty is probably a little bit bigger in our community than some people even realize. And just before we get into that, actually, I was talking to my kids the other day about, life stuff and everything. And I said, did you know that the average 1-bedroom apartment is $900 a month? And I was just blown away by that, right? And so maybe they'll live at home a little bit longer. Anyway, thanks again for that. The reason we have you here, Belle Jamieson, and then we have Leah Willems from North Lambton Community Health Centre. There's a mouthful.
North Lambton CHC, yes.
You got it.
And I think, first hear that, we hear community and health center. So there might be some obvious things as to what that is, but boy, I was going through the website and more, and I was like, wow, there is just so much going on with you guys. Belle, why don't you start things off here for us and just kind of tell us what is North Lambton Community Health Center?
Sure, absolutely. And Leah, feel free to jump in. So the Community Health Center has been in the community for 25 years. 2020 was our 25th year. We had big plans, but we will have to wait for our gatherings when it's safe to do so. And we have 4 primary care sites, and we have one of our primary care sites is in Sarnia on Exmouth Street. And we at the health center, we provide primary care, so that's going to see your doctor, nurse practitioner, and we have our rostered clients who access that. And then we also deliver health promotion, chronic disease programs, and wellness programs to keep people well. And that's also part of our model. It's very much a holistic approach to care, so it's not just about the physical, it's about total wellness, emotional, social well-being as well.
Yeah, so there's, like I said, there's a lot happening there. So are you in Sarnia or are you in Forest? Where are you?
Today I'm in Forest.
Okay.
And I'm in Sarnia.
Yeah.
All right. And Leah, thanks for that intro there, Bella, but Leah, what's your role in all of this?
So I manage our chronic disease programs. We have a variety of chronic disease programs throughout the county. We mentioned Forest and Sarnia, but we also have sites in Watford and Kettle Point as well. So some of the disease management programs we have are diabetes education, cardio and pulmonary rehabilitation for people with chronic heart and lung disease. We have a heart failure program led by a nurse practitioner, and we have a falls prevention program with our occupational therapist who was in with you in the winter doing the penguin walk.
I was going to say, is that part of the penguin walk? I think we had a couple of young ladies on here last year talking about that. Do you want to demonstrate the penguin walk?
I might need a refresher.
But it's important that you think, though, something as simple as cautionary walking, even for those of us who are quite mobile, the penguin walk, even we'll have to have them back and show them. But that with the ice and everything, it's a lot of us take advantage of the fact that we're able to get around so well.
Mm-hmm.
Would you say that are enough people getting to know about your programs?
Well, I think we always want to share that our primary health care, so if you need to see a doctor or nurse practitioner, you do need to be rostered, but almost every other program we offer is available to anyone in the community. Right. So probably the best way, you mentioned our website, is to access our website, nlchc.com. And we've got our programs listed there. Under events, we have our monthly program calendars. and also calling our sites and just finding out what's available and what people can access.
And you have quite a calendar going on here. That was one of the reasons I reached out to you. I was like, wow, there's so much going on here. Like you've got like virtual low impact and virtual night light, and those are regulars. But then you've got, I'm really curious about this event coming up, this virtual Me, My Mask and I.
Yes. That one is actually being delivered by our social worker, Joy, and that came out of lots of questions. People still have lots of questions about masks and usage and research and why. So Joy has put together an excellent PowerPoint presentation, and she'll be doing, it's a very interactive session that she'll be delivering, and it's an opportunity for people to hear about it, also to learn if they're having some difficulties with it, how they can cope with that, and some strategies that they can use. And I'll put a little plug in for Lambton College here, but we're also going to be partnering with Lambton College to do some e-bits around that. So that is that's coming up, yeah, which is really exciting. But and can I just do a little shout out to our staff team and volunteers?
Shout out to whoever you want.
Okay, because you had mentioned earlier some shout outs, and I was like, you know what, I'm going to give a little shout out to our team. So we have an incredible staff and volunteer team who, when at the onset of the pandemic and all throughout, have really shifted gears and pivoted to be able to continue to deliver the quality care that they can, and really changing the way we deliver our programs and services and our care to our clients. So just a little shout out to them because they're doing great work.
Yeah, well, great teams make great things happen, right? So it's always good to recognize. You sent me this earlier, and I wanted to talk about this.
Yeah.
Equality does not equal equity. Explain what that means.
So at the CHC, we certainly practice through a lens of equity. So it's not like each person gets exactly the same cookie cutout service. We meet our clients where they're at and recognize that along the journey, sometimes people may need a little extra help or a little extra support so they can have the same access to services or care or quality of life. So, sometimes, it might be, connecting them to food security, or connecting them to services or transportation so that they can get to a program. So that's where we kind of, we look at health and we look at services through that health equity lens.
Right. So you're really saying everybody welcome.
Absolutely.
Right. Yeah. And I think you heard me talking earlier, about asking for help, and that's often one of the biggest barriers in the beginning stages, that for whatever reason I don't want to ask for help. I'm fine, or I don't want to look stupid, or those kind of things. Right. And is that part of, and sometimes money's the other thing too that stops people from asking for help. Is that a part of your promotion here too? Is that it doesn't matter where you're at?
Yeah, absolutely.
It's free, right?
It's free. All of our programs are free.
Yeah.
And like Leah had said, you don't have to be a patient of the center to access the programs and services. So anywhere in Sarnia Lambton, people can access the programs and services here at the center. And also, removing those barriers, helping, removing the barriers of cost, removing the barriers that people might be having to access services, working with them.
I found one. Sorry, go ahead.
Oh, well, and just meeting people where they're at. So our harm reduction and hepatitis C program, for example, they do outreach and confidential harm reduction services for people who use substances. So instead of judging people when they're coming or needing help, we'll provide them the help and support they need in that non-judgmental atmosphere. And again, just meet them where they're at.
It's really, really important. I guess it's kind of a mental health thing too that goes into that, right? Is to help people relax and feel comfortable and welcoming. And I noticed like diabetes, for example. I'm type 2 diabetic, and that program, I've heard about that. You have different programs for all kinds of different things, right? Do you have a hard time deciding, like, we need this program or we need to fill this gap? Are you constantly meeting to say, what else can we do?
Absolutely. And, we look at what are the needs in the community. We absolutely value our partners, and we look to our partners to see what are some of those needs in the community. And we look to the clients to tell us what their interests are and what they need. So, for example, at the onset of the pandemic, people had lots of questions and they just didn't know where to turn for information. And so we had, we had our social worker do a session on better days ahead, and people were looking at strategies for coping. And so she did a quick half-hour segment. We also had some live Facebooks where the doctor is in, and two of our docs were answering questions, because people had lots of questions, especially at the beginning when information was coming out, and we in healthcare were trying to wrap our heads around it, let alone everyone, right, trying to figure out, okay, how do we respond to this? So absolutely, yeah.
And to continue to making it accessible as well. We haven't really talked about it, but are all these in person, or is this virtual, or is it a combination?
Combination. So some of those pictures I had sent you previously. So some of our programs, we went right into virtual at the onset of the pandemic, of course, as it wasn't safe to be in person. But as the weather got better and we were able to be outside and spaced out, we're able to do some of our programs. So our coffee time groups, bringing people together spaced out to deliver that program. And we have a super innovative team, and our volunteers are amazing. So doing some outdoor exercise programs where people are spread out. Like in Forest, we were at the Ball Diamond, because there's a lot of the buildings aren't available to be used. And Sarnia, we're at the waterfront, so there's a space there. Our volunteers and staff had everyone spaced out, and so just being really innovative and creative, and looking at why not, and let's try something different, and what's going to work. And we have some volunteers in Sarnia who were continuing to do some outdoor exercise. So they said, you know what, the mornings are too cool. Let's move it to the afternoon. So we're delivering the programs now in the afternoon. So it's not so cool.
Right. But that being said, winter's coming, right? So what's the plan of action there, Leah? Have you got any thoughts on that?
Well, we'll continue to wax and wane as we need to, and shift to virtual as the weather gets cooler. But I think continue, as Belle mentioned, listen to the community. And if they're willing to come out and within safety parameters, if they want to keep doing their thing, we're going to try and support every means that we can.
Yeah.
And we do have some municipalities that have allowed us to use the building with the safety parameters in place. For now, as the numbers are allowing, we're able to use the spaces indoors.
Yeah, well, that's great. And so there's a collaboration like with city as well on all of this, or different areas of the city that are helping you with your programs, like saying we have space available to you.
Absolutely. So existing partnerships. So with the municipality of Lambton Shores, Watford Township, Moortown Complex Centre. So we do have some partnerships where we are able to use the space. Right.
Okay. So if somebody had some space that they wanted to say, hey, I've got some space here, you're welcome to use, you'd be open to that?
Sure, as long as it's free. We are not for profit.
Well, that's why I was kind of going that way.
I like your thinking, David. I like it. So if somebody has some free space to offer, because many of the spaces we did use were in churches, and some of them are not available to be open as of yet. So if there was an opportunity, or someone had some space, a large space that we could utilize for exercise in the indoor months, give us a call. We'd love to talk to you about it. Yeah, thank you.
And the number that I've got here, I know there's different numbers here, but I've got a 786 number. I guess that's one of the numbers. But like you said, the best place to go is go to the website. And if you go there, folks, there's I've been there a few times. There's lots of information, all the events, everything, how to reach out. It's all there. It's a very well done website, actually, as well.
Oh, thanks.
And you've actually got some fans out here, like you talk about. So WLCHC saying together we're strong.
Awesome.
And who's Rebecca?
Rebecca is our facilitator for the Opening Doors program, and that's one of our programs that's funded through United Way. I know you had Dave Brown previously, so that is one of the community programs that's funded, and that's a mental wellness program. And can I tell you, that program at the onset and throughout the pandemic has just been so essential. Connecting with clients and ensuring that they're okay. And we've had clients say that this program has saved my life. That the support offered throughout that program, got them through a dark time, and then they got connected to social work. So lots of great work done within that program in the community, and great connections to other programs within the center as well as in the community.
Right. Rebecca, send me an email. We'll have you on the show. We'll talk about Open Doors.
Great.
Seriously. No, hey, it's important, right? It's to sending more of these messages out more and more. I think tell me if I'm wrong, but I think there's a lot of community services like here and so many other organizations, but people just aren't sure where to start. I mean, you'd think just go Google it, right? But what do I search for? What am I looking for? Do you guys struggle with that awareness thing at all? Like, I know we're doing this to help that, but what other kind of things are you doing to create awareness? Because there's so much going on there.
I think one thing as there's various networks of social and health agencies in Sarnia Lambton, we're trying to take a no wrong doors approach. So
Right.
if someone comes to our door looking for X service that we don't offer, we will try and help find them that service before turning them away. And I think that's happening with other organizations for us as well. And just recognizing that we all really need to work together to help the community.
Mhm.
Collaboration keeps us strong, right?
Absolutely, absolutely. And one of our services here at the center is our community navigator, who does exactly that. So when a client comes in, they just, whether they're new to the community or an issue arises, they just don't know where to turn. Our community navigator will work with the client and try to help them get connected to services that they need, or research it for them, with them, as well as supporting them along that journey.
Yeah. Fantastic. And it sounds like you do have quite a team going, because they're all watching. Nobody's working right now. They're all watching.
Don't tell the boss.
Right. Okay. Well, I think it's a great idea, and I have seen, the community health centers grow over the years, Where did that, I know you said it was like, 25 years ago you said it started?
25 years for our site, for our center.
So where did this all come from? What was the beginning that said, like, was there a gap in communities, and how did it start?
In our community, I believe there was a gap in primary care. They were needing some rural doctors in the area, and then they were looking at the CHC model as something that would be a great fit for the community. And then I believe there were some community members that got together and went to the provincial government, and there was obviously some conversations that went on there, but we are one of like 75 CHCs in Ontario, and there are many CHCs across Canada as well as across the US and the world. So it's a great model to work within, and I think we certainly are filling gaps. And we work with vulnerable populations, so people who are marginalized and tend to have barriers to accessing services. So I think we are honored to serve that population.
Yeah. Now, talk about money here for just a minute. I know everything, it's unfortunate, but money isn't everything, but it is up there with oxygen. We need it to live, right? And organizations do, and especially in times right now, there's a lot of struggles for different organizations. Now, you mentioned United Way. How else do you fund all these free programs that you're putting out to the community? Leah, do you want to take that, or I don't know who's more?
Sure. Yeah. So primarily our funding is from Ontario Health West, formerly the Erie St. Clair LHIN. So this year is really the transition year. Of course, 2020, isn't it, for everything? But so we're grateful to receive that funding, and really that's how we're able to offer so many programs.
Right.
And really the hope is that through our health promotion and disease management programs, that we can prevent illness, therefore saving the system money down the road. Yeah. Through that grassroots approach.
Right. And I know, like, Age Friendly Sarnia has been, recent to the city and area from different areas. And that's been a big, has that been advantageous to you as well to be a part of that?
Absolutely. It's a great network to be a part of, and there's still more growth. And maybe you have recently heard of Family Counseling Centre partnership with Lambton Public Health, working towards a new care pathway for older adults to be able to access, one number to call, and certainly they would be referring to all these community agencies in the community for people.
Yeah, again, collaborations, making it all work, right? Yeah. That's fantastic. Well, I thank you both so much for taking time out of your busy days here today. Is any final words before I let you move on?
Leah, anything?
Leah's I'm good.
I can think of. Again, like what Val said, shout out to the team. They're the ones that have been doing the work, and I think really thinking out of the box in terms of how do we connect with people who are isolated during an already isolating time, and they've done such a good job at doing that.
Yeah.
And
West
just a
Lambton's here
reminder,
saying, oh, sorry, go ahead.
Oh, sorry, no, I was just going to
No,
say, and
no,
just
you
a
go ahead.
reminder that everyone is welcome. You don't have to be a patient of the center accessing your primary care here to access the programs. They're free and open to everyone.
Yeah, that's great to know. West Lambton's watching. They're saying we're also building up our YouTube page to provide videos with low budget, nutritious cooking classes. Exercise, great. Like YouTube, use it, right? Facebook. Has this been a learning experience for both you ladies and all of you? Yeah, they're like,
Oh yeah, absolutely.
Yeah.
Yeah.
And do you have to, I don't know, before I let you go, the virtual thing, like I would imagine there's some, not just training on the staff side, but for you to be able to train the people using the services. Is that right?
Absolutely. And I think the staff team has been amazing, spending oftentimes quite a bit of time trying to help people understand and access Zoom, whether they're on an iPad or, the different platforms, have been super patient with clients. And Alexa, our OT, our occupational therapist, has been integral in helping people get connected as well, because it's new for all of us. So I think we're all in it together, and everyone is just supporting everyone along.
Yeah, fantastic. Well, shout out to both you ladies as well for all your hard work and all of this. I know it's been challenging, but you keep going, and it seems like things are going really well. And my door's open. So anytime you've got something going on, you want to just send me an email or you want to come back, I'd love to have you back talk, because we could probably do an hour show just on CHC, right?
Oh, absolutely. There's lots of programs. So yeah, check out the website. There's lots of programs. Check out our calendar. Each month there's new programs and services. So please check us out.
Will do. Thank you both. Enjoy the rest of your day.
Thank you. Take care.
Thank you.
You're welcome. Leah and Belle talking to us there today. What great services. And find out more by going to nlchc.com/events, or just go to their website. There's so much there. As I said, it's exciting to see, I think, the creativity that's happening. And, both Leah and Belle said, yeah, it's been challenging, right? But challenge is good, though. We get some good results when we get challenged out there, and we've been forced to be creative. But these services are important in our communities, and they're free, right? So why not take advantage, find out more? And if you maybe don't have something that you need right now, likely somebody who does. I think it's sometimes services where we go like, wow, I don't really think about needing that until something happens in your life that you do. But it's good to educate ourselves, just know what's available, because you'll probably bump into somebody to go, hey, have you heard about? Right. Thanks again to both of my guests, Leah and Belle, for joining. All right. Well, some more great things happening in the community, and it's part of Santa, ho, 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 and all that stuff, Christmas. Alison Morrison is here from Pathways Health Centre for Children. Thanks for being here, Alison.
Good afternoon. Thanks for having me.
Yeah. And you're okay. You got your technical stuff working too, right?
We're good to go.
Everybody's got a set of headphones with a microphone now, right?
It's the in thing.
It's the in thing. That's right. Well, listen, Pathways Health Center for Children, obviously provides a lot of great services in our community as well. And probably similar to what you just heard me talking about, time to adapt, right? And Santa, the Secret Santa, is going to look a little different this year. Absolutely.
We've had to really take a look at our Secret Santa shop that would be its 16th year in the making for us this year. Over the years, we've had many, many children come through our doors here at Pathways to do their Secret Santa shopping, to shop with elves and pick out that special gift for their parents or their siblings or grandparents or even their pets. In past years, they've been able to come into Pathways with their list and go into a spot where they could hand select gifts and spend some time with some hot chocolate and some cookie making afterwards, and then leave with that bundle of surprise to share on whatever occasion over the holidays where families choose to open them. And with COVID-19, it presented some new challenges for us, and we really wrestled with the idea of how we could move forward, but we knew we couldn't not do anything. We knew that our community counts on this. Our children love this experience. And it's a significant fundraiser for Pathways Health Centre for Children. So our fund development team put their heads together and reimagined how we could move forward in 2020.
I love the name, Secret Santa Reimagined 2020, because, there's I think there's a lot of moments in the beginning of all this, and still people going, what are we going to do?
Yeah.
You know,
How do we make
and
this happen?
yeah, and like you said, it's an important fundraiser for Pathways because there's a lot of services that Pathways offers. Can we talk a little bit about the services that Pathways is doing in the community?
Sure. Pathways services just over 2,600 individuals each year. We service children right from birth to the end of their high school years. And then we also have some services that are available to adults in our community, our specialized services like our therapeutic pool, our seating, and our augmentative communication services as well. We also have the Lifelong Learning Program, which is a social enterprise that is for adults with disabilities as well. So lots of services addressing developmental, physical, and communication needs. We're also the hub for fetal alcohol services, the FASD resource hub, and coordinated service planning to wrap around families when there's a lot of service providers that are involved in the care and support of children and youth. We've got about 150 staff that are working in our organization, reaching out to all regions in Lambton County, from Grand Bend down to Port Lambton, over to Elvinston, and all the hamlets in between.
Yeah, I like that you mentioned that, because I think a lot of times organizations like your size and what they're doing, people just think Sarnia, right? But it's really beyond. It's the county, really, right?
Absolutely.
And that's fantastic. I know you've got great community support as well. I say it probably almost every time on the show that we could all agree that this community we live in Sarnia Lambton really knows how to come together and support its nonprofits and charitable organizations. And I see that for this, it's Pembina is a big sponsor for this program. Is this their first time, or are they a regular supporter?
They have been a regular supporter of Secret Santa, and we're so grateful that, again, they present as our lead sponsor for this event.
Yeah, that's great. And what other, I'll ask a similar question that I did to my earlier guests, but how do you fund things on a regular basis? Obviously, fundraising is a big part of it, but do you United Way or government? What else happens?
Pathways is mainly funded through the Ministry of Children, Community and Social Services, so the Government of Ontario. We also receive some funding from the County of Lambton in providing services to licensed childcare settings throughout Lambton County. And then we do rely on funds that through fundraising and special events and donors. In fact, we're looking for $260,000 to be raised this budget year. And of course, COVID-19 is really wreaking havoc with us meeting that goal. So our fingers are crossed that Secret Santa Reimagined 2020 and some of the direct donor reach outs that we're doing will help us move in that direction. Yeah.
And I would imagine you do see continued community support. As I said, this is a great community for that. Are you on track, or is there a long way to go, or what's that looking like so far?
Yeah, we've got a long way to go, actually. We were so thrilled to be identified as the recipient of the Smile Cookies through Tim Hortons.
Yeah, that's great.
So in the month of October, we did learn that just under $45,000 is directed to Pathways. So that certainly helps us out and gave us good reason to smile. But again, a bit of a way to go. You know, in the past, our Secret Santa has raised just around $43,000 for us. We've seen 1,200 children come through the doors and buy almost 5,000 gifts. And so we're interested to see how taking this to this new approach will work. Families are able to shop from the comfort of their own home. They'll get a true Secret Santa experience. So they'll place orders by visiting our website and tell us how many gifts they need in each different age category. And then we have our elves already doing the shopping and wrapping, and they will select gifts for families based on their requests and have them all ready and bundled up for a Winter Wonderland drive-through experience where families will come through and through curbside pickup with hot chocolate cookies, dancing elves, and Christmas trees on December the 11th. We'll be giving families their bundle of purchased Secret Santa gifts that will truly be a surprise when families open them up.
Well, what a unique way to celebrate and support your organization as well. Are you seeing some come in already? Can you give us an idea, like what kind of gifts are we seeing? Do you know?
So the gifts that we have received, we go actively throughout the year and hunt them down and purchase them and wrap them and have them ready for this event. So we make sure that there are gifts for all ages. Gifts for, as I said earlier, even pets, because that seems to be a high request amongst our shoppers. And we have them all pre-packaged and ready to go in response to the orders that will come in. So you might tell me that you need to order, for example, 2 gifts for adults and 3 for children that are of preschool age, and our elves will go right to it and find the right thing to meet that order.
Okay. And how much is it? Like, how does that work?
So each gift that you purchase will be $10. So if you've decided to purchase 4 gifts, then there will be $40 that you'll need to direct to Pathways, and you can pay online by visiting our website, or if you need to, by speaking with our fund development officer, and she can arrange payment over the phone.
Sounds like a lot of fun. I know I got to do some Secret Santa shopping when we're done here today, because well, you know, it really is like I said, it's a unique, fun way, and this sort of thing, it really is important to so many families. Like you said, they've been doing it for so many years. This really has a positive impact on people, and so many people look forward to it every year.
In fact, we hear that families frame the beginning of the holiday season by the arrival of the Secret Santa shop, and they let us know that this signals for them, okay, it's time to be thinking about the holiday season. Again, it's the reason why we knew we just couldn't put this to sleep this year. We needed to find a safe way to do it. We didn't feel we could bring families into our organization in the numbers that we typically see. And yet we felt that this would allow us to do something for our families.
Well, good for you for keeping it alive and well. And once again, for those of you watching the Secret Santa Reimagined 2020, we'll be posting all the links after the show as well. Alison, thanks for your time. Any final thoughts before I let you go?
Oh, I appreciate your time, and I'll wish you a very early happy holidays.
Happy holidays to you as well. Thanks, Alison. Alison from Pathways Health Center here in Sarnia. A great fundraiser. What a unique way to keep things going and support the Pathways Health Center for Children. The Secret Santa Reimagined. Simply go online to pathwayscenter.org to find out more and make your purchases. Maybe somebody will send me one. Hint, hint. Anyway, thanks again to all of my guests for being here. I want to say thanks to Leah and Bell for joining me earlier as well. And again, of course, Alison Morrison from Pathways Health Center for Children here. And of course, thanks to all of you. But I got to say, there's been a lot of shout outs today, but I got to say thanks and a shout out to my friend at Oswald's Diner, who have been great supporters of the show for some time now. The motorcycles are still out there a little bit. I'm putting mine away this week. You heard my sadness earlier at the start of the show, but keep an eye out there anyway, because you never know when they're going to be out there. And riders, be aware as well. And of course, to all my regular supporters in here as well, to Huron Signs SWO and AG Event Graphics, Active Ears, Hughes Intelligence Canada, Joe's Discount Tire. Get those snow tires. I did a live with Colin Vandenhoevel for Preferred Towing on Saturday night. All seasons tires are not all season. You need winter tires. So head on over to Joe's Discount Tire and let them help you out. Philly Cheese Jakes and my son from J-Man's Affordable iPhone Repair. He says, how come I don't have a picture up there, Dad? I'll work on that. And of course, thanks to all of you for joining me here every week. And if you've got somebody that you'd like to maybe see on the show, reach out to me and let me know. Or maybe there's a positive story or just some special event that's coming up. I'm not hard to find. Send me a message on Facebook and let me know. I'd love to have them on the show. You can also find out more about what's happening in the community. I post some news events as well on my website, theshowlive.live. And of course, I'm on Instagram and Twitter as well. And I'd really appreciate you going over to my YouTube channel if you haven't yet and subscribe to my YouTube channel. I'm just over 700 subscribers. My goal is to reach 1,000 subscribers by the end of this year. Running out of time. Wow. what day is it? Christmas is going to be here pretty soon. So I'd be a great Christmas present that you could give me. Go and subscribe to my YouTube channel. And of course, follow me along on Facebook. That's all the time I got for you this week, everybody. Have a great week and an even better weekend. I will see you next time right here on the show. Bye for now.